In this video, we will teach you how to perform a proper venous examination. After introducing ourselves to our patient, we will begin with a general examination. Start by palpating the peripheral pulses, which include the dorsalis pedis pulse, posterior tibial pulse, popliteal pulse, and femoral pulse. You can refer to our arterial examination video for guidance on how to locate them. Then inspect for varicose veins, and check for edema using the pitting test. The pitting sign is a clinical test used to assess fluid retention by applying pressure to the skin and observing if a visible indentation remains. Don't forget to examine the peripheral venous system with the patient standing. When examining, we trace the course of the great and the small saphenous veins along the inner leg as well as the back of the leg. This helps us determine if the varicose veins are dependent on the saphenous axis. Now let's continue the explanation with a new patient. We introduce ourselves in the same way and perform a general examination as we did before, palpating the pulses, checking for varicose veins, and assessing for the pitting sign. Observe the presence of spider veins on the patient. With this, we will move on to explain the classification of chronic venous insufficiency, which is done using the CA classification ranging from 0 to 6. Level 0 indicates no visible or palpable signs, up to level 6, which includes eczema and ulcers. Remember that in chronic venous disease, there is abnormal blood flow in the veins due to valve insufficiency, and the most common manifestation of this is varicose veins. We continue the examination of the patient standing, like before, in order to palpate and determine if the varicose veins are dependent on the saphenous axis. We show you here a visible varicose vein. Now we will perform a series of maneuvers and tests to assess the competence of venous system. We start with the PERT test. This test assesses deep venous patency and perforator sufficiency. With the patient standing, a thigh tourniquet is applied, and the patient walks. If deep veins are patent and perforators are competent, varicosities below the tourniquet disappear. We continue with the percussion test or Schwarz maneuver, which evaluates superficial valve incompetence, also known as the wave sign. With the patient standing, we palpate the venous or varicose path with the fingers of one hand, while using the other hand to percuss over the proximal course. If we detect changes distally, the transmission of the wave confirms the presence of venous reflux. In the second phase, we percuss at the upper part of the varicose vein. If the valve system is competent, we will not perceive the wave. Finally, we explain the Trendelenburg test, which evaluates the competency of the saphenous valve and perforators. With the patient lying down, raise the limb for a few seconds to completely empty the superficial venous system. Then place a tourniquet and ask the patient to stand up. The two possible results are: if the varicose veins do not refill, it indicates that the reflux originates from the proximal part of the bandage, suggesting incompetence of the great saphenous vein. When the tourniquet is removed, the varicose veins will refill. If the varicose veins refill while the bandage is still on, it suggests that the reflux is coming from the incompetent perforating veins distal to the tourniquet. Thank you for your attention, and we hope you find the video helpful.